So back from the ER, it's a few weeks ago. And this is like towards the end of my time in the ER. And at this point, I should have known, what to do. But like, no one gives a fuck of like how they deal with the patients. And it's all like, poor people. So they're like, oh, let's just like, we'll tell them, but we won't really tell them what's going on. So I had kind of a lax attitude. And so this lady came in.
Well, plus everyone speaks Spanish who comes in.
Yeah,
so there's
exactly.
this language barrier.
Yeah.
Everyone's poor, which I don't know why that changes anything, but it does.
I think that just like makes it that they don't understand as much of like what's going on with their care.
Yeah.
And so the doctors don't really explain as much as I think they should. But this lady came in and she just had like a little bit of shortness of breath. And, they told me to go see her. And I was like, oh, no, actually, I think I volunteered to go see her. And I was like, oh, okay, I'll go see her. And so like just before I went, I just looked in her chart. And, I saw her name, whatever it was. And then I saw that a COVID test had already been done. And I saw her vitals. And she was like, her heart was a little faster. Anything else was like, okay.
And vitals, that's just like blood pressure, heart rate, your respiratory rate. What else?
And oxygen saturation.
Yeah.
So all that was good. She wasn't in any distress or anything. So I want to talk to her and I was like, hey, how are you doing? When did the shortness of breath start? She's like, oh, a day ago. And some other bullshit. She didn't really have any other symptoms. I did a physical exam and I was like listening to her lungs. Everything was good. And while I was doing the physical, I was like, so have you been vaccinated for COVID? She's like, no, I haven't. And I was like, why not? Why haven't you been vaccinated?
Did you shake her?
Yeah. And she was like, oh, I just want to wait. I don't want to be one of the first. I want to wait until everyone gets it and then see if anything bad happens. They're like, okay. I was like, because you have COVID. And she's like, what?
You told her? Wait, it came back positive and you're like,
No. So she's like, what? And then she fucking puts her head in her hands and she starts bawling. And I'm like, oh my God, what do I do? And I'm like, there, it's okay. Kind of thing. And I was like so shocked because that's never happened to me before where someone like does it. I'm like, what the fuck is the big deal? You have COVID, you'll get better, whatever. It's like, if this is you having COVID where you have like nothing going on, then like, what's the big deal? Mm-hmm. And I kept asking her, I was like, yo, what's wrong? Like, what's the matter? Why are you like breaking down? She's like, oh, I have kids at home. I was like, so like, why does that matter? Like, your kids are fine. And she's, do they have to get tested? I was like, yeah, probably. And she's like, I just gave birth a little while ago. I'm fucking terrible at this point. Like everything, now that I'm saying it, everything sounds like the wrong thing to say.
That's you in general,
yeah,
I feel like, so that's nice.
It probably was. And then I finished the physical and I was like, oh fuck, am I fucked for like telling her this? And I was going to go tell the resident that like, hey, I made a big oopsie. And I told her she has COVID. I didn't know if you guys wanted to do that. And I was like, you know what, just before I say I fucked up, I'm going to go check the computer. And I made a mistake. I thought COVID positive meant she was positive, but it meant the COVID test was done.
Oh my God.
I looked and it said COVID came back negative. And I was like, oh shit. I was like, oh.
You made a woman cry for nothing.
I'm so sorry. But I just double checked. I misread it. And then the COVID is actually negative. It just said the COVID was done. And she like was like, oh my God, I'm so relieved, blah blah blah. And she's like, okay, I'm glad because I don't go anywhere. I was like, okay, good. And then I had to go present to the resident. And I was like, should I bring this up? And I was presenting. He's like, okay, let's go. I was like, guess I'm not gonna mention it.
Oh no.
So it never came up again. And then later, like I was taking her to X-ray to get a chest X-ray, and she's like, do you think, blah, blah, blah. I was like, don't fucking ask me. I told you I had COVID. You didn't have COVID, so obviously I don't know anything. But she was chill about it. I was like, I'm just a med student, I don't really know anything, so take it.
That is nice that we have the ability to just take all responsibility away from ourselves and be like, so I'm just a fucking idiot medical student, and anything I say is nothing. It means nothing.
Yeah, it's been super nice to be able to say that, and I'm like kind of gonna miss being able to say that.
Oh, dude.
I can't believe I did that at the end of my fucking rotation. Like, it shouldn't have been that late, and I should have like done it with like more class and like double checked. But fuck it, man. You learn.
We're figuring it out, man.
You learn from it.
Well, that's the thing. Like, nurses are like the soldiers of the medical, like, of the hospital. Doctors know a lot, But I think the main difference between the two is doctors are responsible for fucking everything. Like it all comes on their head if shit goes down. And so it's just like double check, triple check shit, you know.
Yeah, but honestly, like I shouldn't even like cared because the nurses like say that shit all the time. They're like just so like upfront about it and blunt, and like they don't give a fuck. I'm like,
and some of the small stuff that we're sweating now, we're not even gonna think twice about it in the future. Like we'll accidentally tell someone, "Oh, we fucked," you know, "Oh, I said a positive COVID test, but it's actually negative." It won't even phase us at some point. Maybe I don't know. It's just a guess.
That was my biggest problem for like that week. So life's pretty easy right now. I like it.